Hi everyone, today we're going to be talking about coronary artery disease. Coronary artery disease is a major silent killer, and the daily impact in Canada and the USA of heart disease is still the #1 killer of men and women every year. Every 7 minutes someone has a heart attack. Every year close to 70,000 Canadians will have a heart attack. Every 10 minutes someone has a stroke. A stroke is basically a heart attack of the brain. Now, heart attack disease is due to various preventable yet modifiable risk factors. And what are these risk factors? Some of these risk factors, at least the major ones, are high blood pressure, otherwise known as hypertension, high cholesterol, otherwise known as dyslipidemia, with high bad cholesterol or the high LDL cholesterol, low HDL or low healthy or high density lipoprotein cholesterol, and high triglycerides. Diabetes mellitus or diabetes is another major risk factor, along with various family and previous personal history risk factors such as hypothyroidism, alcoholism, and other risk factors. Okay, these and other risk factors can and must be modified or treated early to prevent or delay coronary artery disease. Another major risk factor not mentioned previously is smoking. Cigarette smoking, especially in susceptible people, will accelerate heart disease even more so. Going as to different causes. High blood pressure basically damages arteries, which then leads to cholesterol deposition in their walls, which leads to narrowing of the artery. High cholesterol being present in the blood just accelerates this narrowing of the arteries. Diabetes accelerates high blood pressure, high cholesterol, and increases inflammation in the body and in the blood vessel wall, and thus further accelerates hardening of the arteries, along with heart disease, strokes, and peripheral vascular disease, which affects your arms, legs, etc. Heart attacks occur basically when the blood flow in a major artery to the heart is critically narrowed, which is usually more than 50%, so that heart muscle cannot function. The heart muscle never gets a chance to rest. It must continually have blood supplied to it. Heart muscle dies because of insufficient blood flow, you get a heart attack. If heart muscle almost dies due to insufficient blood flow, you can get angina in some people. Now, angina in other people can be silent, especially in diabetics, and this is more dangerous because these diabetics are more prone to getting heart disease. Heart damage is dependent on the degree and extent of narrowing of the coronary arteries. Small heart attacks can be silent and can go unnoticed by the patient, the doctor, or other healthcare practitioners. Larger heart attacks, however, can cause sudden death when the heart suddenly stops beating, or other catastrophic complications occur, such as rupture of the heart, breakdown of papillary muscle with secondary loss of valve function, and lack of or insufficient blood flow within the heart and the arteries of the body. Why should you be concerned about high blood pressure, high cholesterol, and diabetes? All of the three above risk factors increase the risk for heart disease and stroke, which are the leading causes of death in North America. More importantly, why should South Asian people need to consider this more seriously than other groups of people? This is because if you're of South Asian background, you could be at increased risk of developing coronary heart disease, which could lead to a heart attack. Even borderline high blood pressure, borderline high cholesterol, borderline diabetes, mellitus, will all raise your risk for heart disease and stroke. And this risk only increases with age. Prevention and control of cardiovascular disease with some evidence-based natural formulations. Like I said, we need to target high blood pressure, high cholesterol, and diabetes and other risk factors. Quitting smoking is virtually a no-brainer. Avoiding alcohol is also important because that especially in South Asian people, it increases the risk for diabetes. With the more that they drink, the longer they drink, the more their risk increases, especially if they have a family history of developing diabetes. There's strong clinical research and historical evidence for use of garlic heart drops, such as Dr. Coley's heart drops. Numerous studies demonstrate the benefit of garlic on cholesterol profiles, so favorably improving with reduction of total cholesterol, decrease in LDL cholesterol and triglycerides, and also in patients with high blood pressure, garlic is thought to reduce blood pressure by causing smooth muscle relaxation of the blood vessel wall, allowing for a reduction in blood pressure. And evidence in human trials also suggests garlic inhibits the inflammatory compounds within the body, such as C-reactive protein and other inflammatory cytokines, which are also involved with deposition of cholesterol and other debris into the artery wall, which then leads to narrowing. Garlic also has been found to have blood thinning properties, as it can increase the blood clot dissolving effects within the blood, and it decreases platelet activation, platelet aggregation, and adhesion of platelets, and thus decreases blood clot formation in the blood vessel. Now, the mode of action of Dr. Coley's heart drops, it has several constituents. The hawthorn extract. Hawthorn is a flowering shrub of the rose family and has an extensive history for use in heart disease going back to the 1st century AD. Hawthorn acts on the heart by increasing the force of heart muscle contraction, but it lengthens the refractory period, which slows down the heart rate, and then also it induces dilatation of the blood flow within the coronary blood vessels, and it also basically increases, by increasing blood flow, you're allowing for increased oxygen consumption by the heart muscle, but because of the stronger contraction, you're still not compromising blood flow from the heart. The other thing found in capsaicin, or in Dr. Coley's heart drops, is capsaicin. It's a red chili. Research has shown that it can reduce the bad cholesterol, the LDL cholesterol, and may also increase the good cholesterol, or HDL cholesterol. There's also strong evidence that it may increase blood flow due to the lowering of blood pressure in the blood vessel due to dilation of the blood vessel from release of nitric oxide within the circulation. The main points of this Dr. Coley's heart drops is that it's Health Canada approved. The herbal extracts are very potent and work together synergistically, meaning that the three combined ingredients work better than singly by themselves. The extraction methods are unique and proprietary and are designed to increase the absorption and the availability and thus the effectiveness of the ingredients once you do take them in. They provide for more value for money for patients, as one bottle may last for up to 2 months depending upon how you use it, and patients get ongoing benefits from ongoing use of this product. Adults should take anywhere from 20 to 30 drops 2 to 3 times a day with 30 cc's of water.